Take the first step and let go of the fear. Realize love is all.
And why place matters. We know that neighborhoods count. We know that they have a tremendous impact on the happiness, on the health, and on the prosperity of people who live in them. What we haven't known up until now is a lot of research from our own community that actually makes the link between determinants of health, the neighborhoods in which we live, and the assets that exist in our communities.
So the project was a partnership between Southeast Ottawa Centre for a Healthy Community and the No Community Left Behind program of that centre in particular, and the University of Ottawa. And we had 4 groups involved. The neighborhood that has more recreation, it has more space, a lot more recreation, and also where No Community Left Behind has been working in for a longer period of time. So I think some of the positive things we're seeing from that community are possibly because of No Community Left Behind's work.
I see is a real energy in the room right now about everyone intuitively seems to understand that when you start talking about place, that at the end of the day, we can talk about city, we can talk about region. It's really, what matters is where we live and the immediate surroundings that we live. And that's really where all the physical and the economic and the social stuff comes together. And I think what this project and what today is going to demonstrate is, this is a kind of, when you start taking that way of thinking and that way of working, this is what you can learn. This is what you can actually understand. And from that can come all the interconnections around how each of us do our jobs and do our work in communities as residents, as community agencies, as governments, as politicians.
Work is neighborhoods, is where it all comes together. And that's the lens through which we're approaching this particular initiative and the work that we're doing increasingly in United Way.
There's some very interesting information coming out, some national studies, for example, by the Canadian Institute for Population Health, that's showing how the characteristics of neighborhoods, the networks, the social infrastructure, the way in which they're organized in terms of design, the lighting, for example, how these have a significant impact upon health and well-being. We also know that it's only in place that we can bring together all the pieces that make sense in people's lives.
We have a whole number of issues in which we're working: children and youth, seniors, people with disabilities, new Canadians and immigrants, individuals and families in crisis. But one of the things that we've learned through all of that work is neighborhoods is where it all comes together.
Is really around starting to converge our services into a geographic place, into neighborhoods. That's the next direction we're going. We started looking at broader citywide community agendas: children and youth, seniors, immigration, integrated drugs and addiction strategy. There are a whole bunch of strategies we've undertaken, and we did it because we wanted to bring together the multiple services in the city and the community and break down those silos. That was really an attempt to start to get at these things. We're now taking it to the next level, and that was our plan. We've been working on a community development model now for the last couple of years, and when we saw No Communities Left Behind in a bid, thanks very much, and David Hole, I think he's left, I don't know if he's still here, but and Sylvie and all the people that started this project, the light went on for all of us that were doing this research behind the scenes in terms of what's the best practice. It's an approach, and I think what a bid said that struck me, and I hope struck you, it's not so much, you know, the quadrant has to be implemented exactly like that. It's about getting people together and talking about what is the assessment of that neighborhood, and then coming up with strategies to deal with it. It won't always be police-led. Sometimes it might be parks and recreation-led, housing-led, public health-led. It could be multiple people leading it. Doesn't matter. The point is you come up with strategy.
We need investments federally and provincially in affordable housing, in childcare, in quality education, and in health. But it's only in neighborhoods where we pull all the pieces together and make it real for people and their lives. Because oftentimes the services that we have, even though they are essential, are set up in streams, as you know, or in separate channels, and they don't fit together. And so even if they may be available in a community, they don't work well for people. And sometimes they even actually have an opposite effect. They work against each other, where an improvement in one area inadvertently disqualifies you for something else. So we're in place, we can make that happen together. And then we also know that in place, it's really the only way that we can give voice to people in a real way on an ongoing basis.
Take the first step and let go of the fear. Realize love is always near. To be free, to be happy, is to be one.